Welcome back. Did you know that last year 1 out of every 10 babies were born premature in the U.S.? That's according to the CDC. It's a problem many expectant mothers face but don't know how to prepare for. Here with more certified nurse midwife for WellHealth Quality Care, Laura Pearson. How are you?
I'm well. How are you?
Great, thank you. Now we hear the word premature, preemie a lot. Can you explain to us what that exactly means?
Sure. So people say preemie. That's short for premature or preterm birth, and that means a baby that's born before 37 completed weeks of pregnancy.
So that's the technical term for that.
That is the technical term.
And a lot of women go through this situation. It's very scary for them.
They do. I think, like you said, the most recent statistic was 1 out of 10, and I've heard even 1 in 8 women face this problem.
And why is it such a concern for people like you?
Well, you know, I think there's kind of a misconception that even babies born just a few weeks before that 37 weeks, that it's not a very big deal. But when they are born too early, they can face many health issues. Babies born too soon can spend weeks and months in the NICU, the neonatal intensive care unit. They can have feeding problems, breathing problems is a big concern. They have a huge infection risk. They can have problems for the rest of their lives with hearing and vision problems, and
a lot of health concerns.
Yeah, many health concerns.
Yeah.
There's more even than I thought of. So
can we talk about some of the contributing factors for premature birth? Are there things that we can do to lower our risk?
So there's some that we can do, yes. There's, I mean, we really don't know a lot about preterm birth as far as all of the risk factors that are contributing. But the ones that we do know about, if a woman has had a previous birth that was spontaneously preterm, or having had having more than one baby at a time, so twins, triplets, having a problem with the uterus or the cervix, chronic health problems like diabetes, hypertension, blood clotting disorders, having certain kinds of infections, alcohol use, tobacco use, and actually lack of prenatal care as well.
So those are some of the risks. But do women know that they're going to have a premature baby? That's not something that you can predict.
No.
Right?
And so a woman can do everything right, but even with all of that, sometimes it still happens and we don't know why.
But you obviously encourage women to take care of themselves before the pregnancy and during the pregnancy.
Right, and that's why prenatal care is so important. There are some things that that mothers can do, and we can also teach them about what it is that they need to look for.
Yeah, let's talk about some of the symptoms and those warning signs.
So symptoms and warning signs of preterm labor are going to be the same kinds of things that look like real labor. So having contractions, so pains in the belly that are happening more often than once every 10 minutes, pain in the lower back, having pelvic pressure that feels like the baby's moving down, or having changes in vaginal discharge, looks like bleeding or leaking of fluid.
And Laura, are there places that women can go to for help or resources?
Certainly. So one of the best resources that women can look for is to go online to go to the March of Dimes website that has a lot of great information. And there's also some other online resources such as Hands to Hold or Graham's Foundation, and those are great resources just to provide support from parents who have already been there to help parents going through it.
Yes, there's a lot of support out there if you know where to turn to.
Right.
There's a lot of women going through the same situation. And just a moment ago, we were talking about the symptoms and warning signs. Now, we mentioned even if mothers do everything right, one of those things could make it horribly wrong for them. And you really have to go see the doctor and look at your risk factors.
Right. Yeah, so definitely that's the most important thing is being seen, especially if you have had a previous baby that was born preterm. Really important to make sure that you get care early, because there are some things that can be done to potentially lower that risk.
And then when it comes to a child with symptoms, and because you have to play catch up almost to a normal baby, but there are things that you can give the children to And being in the hospital, helping them with either fluids or nutrition, that will help?
Right, and so a lot of that care in the neonatal intensive care unit is aimed at supporting those babies with respiratory difficulties, maybe needing to be on a respirator, receiving oxygen support, being able to get nutrition through an IV if their gut isn't ready to have food yet.
And what would you tell some of the women who are pregnant right now that are concerned about having a premature baby?
I would say first, look at those resources to get more information. Your go-to, of course, is always to talk to your midwife or your doctor.
Yeah.
So.
And let's explain the role of a midwife.
The role of a midwife. So we do all kinds of things that similar to what an OBGYN would do. So we do attend births in the hospital. We provide prenatal care. So, if anybody is concerned, we can certainly talk to them about preterm birth. Postpartum care, we also do well woman care and any gynecological issues that come up. So we can do quite a bit.
And you can go and see someone such as yourself even before you get pregnant because some women want to assess their health.
Absolutely.
Is that something you could help them with?
Definitely, yeah. We do preconception counseling, and we can talk to them about how to make sure their health is tip-top before they get pregnant.
And what happens during preconception counseling?
Talking to them, counseling on lifestyle to make sure, like I said, to decrease that risk. So, of course, we talk about smoking cessation, decreasing alcohol or other drug use, potentially making sure their weight is in a great range, and other things like that, just to help them. Vitamins, of course, as well.
Yeah, great information for us. Thank you so much.
All right, thank you.
It's National Preemie Awareness Month. For more information on WellHealth quality care, head to the website or call the number on your screen. They have convenient locations throughout the valley. More to